I really appreciate everyone being here this afternoon. I am grateful to you. I really, I'm leaving as soon as we finish this, going to the funeral of Senator Kennedy in Massachusetts. They wanted me to leave early, and I said, no, I've got to do this town hall meeting. What we're going to talk about today is health care. Everyone knows that. First of all, let me give you some general ideas and thoughts. First of all, one reason we're fighting for health care reform is so that we can allow you and your doctor to make decisions about your medical care, not the insurance industry or any government bureaucrat. We want to make sure that we prohibit insurance companies from denying care based on pre-existing conditions. We want to let you keep your insurance even if you change or lose your job. We want to prevent health insurance companies from dropping coverage for people who become seriously ill. We want to require insurance companies to pay legitimate claims. We want to hold down the cost of health care by providing better preventive care and disease management and by cracking down on waste, fraud, and abuse. We want to make affordable health care available to every American. And I'm convinced that the best way to do this is to strike a bipartisan tone. That's why we're reaching out, even though we have a significant majority in the Senate, we're reaching out to Republicans. They have a place at the table. We need them to get as much done as we can. The problem we have with health care is not a Democratic problem or a Republican problem. It's an American problem, and we want to solve it. Let me give you a few facts about Nevada. Insurance premiums have skyrocketed. We all know that. In 1997, family health insurance purchased through an employer was $5,000. In 2006, it's double that. 220 Nevadans lose their health insurance every day, 7 days a week. That's certainly nothing that we can stand by and let it continue. There are fewer choices due to a consolidated market. The insurance industry, in fact, the two largest health insurance companies in Nevada have a combined market share of about 60% of all the business. Fewer Nevadans have health care coverage. That's obvious if 220 people are losing their coverage every day. In 2002, about 69% of Nevadans under age 65 had employer-sanctioned sponsored health insurance. Now we've lost 4% of that. That's thousands and thousands of people. I want also, before we get into the questions, just take a few minutes and talk about some of the myths that are out there, health care reform myths. First of all, death panels encouraging euthanasia. There's no truth to that. There have been rumors that the health care reform bills include a clause that everyone that is Medicare age will be visited and told how they wish to die. This is absolutely false. The House Health Reform Bill includes a provision that allows Medicare to pay physicians for counseling their patients if they ask for assistance with end-of-life planning, such as a hospice or even a living will. The House and Senate bills don't mandate that people do this. They just provide reimbursement for people who wish to do so. And it's ironic that this rumor has been circulated by many conservative Republicans. But it's interesting, the senator who sponsored this amendment to add this relatively harmless and I think helpful provision is one of my friends. He's a senator from Georgia. He's a member of the Health Committee. His name is Johnny Isakson. Second myth I'd like to just touch on briefly. Illegal immigrants will receive free health insurance. Specifically, the Senate bill defines those who are eligible for premium credits as citizens or a national of the United States or an alien lawfully admitted to the United States. The House bill states, quote, nothing in this subtitle shall allow federal payments for affordability credits on behalf of individuals who are not lawfully present in the United States. Another myth that's being thrown around is that health insurance reform uses money for abortions. Not true. The Senate bill includes a conscience clause that allows institutions, including those like Catholic hospitals, to make decisions about whether to provide abortions without having to worry that their decision will shut them out of insurance provider networks. Next, the House bill states, and I quote, health insurance providers aren't required to or prohibited from offering abortion coverage. The cost of such coverage would be exclusively paid by premiums, not by public subsidies. Public funding or abortion would be permitted only as under current law. That's the so-called Hyde Amendment, named after Henry Hyde, who I served with in the House. And as you know, that is in cases of rape, incest, or when the woman's life is in danger. A couple more myths. Private health insurance will be illegal. Nothing is true about that statement. Neither the Senate or the House bills make private insurance illegal. Government will have direct access to your bank accounts. This is so fallacious. Health insurance reform bills don't give the government access to your bank account. The draft reform legislation streamlines billing and payments between doctors and insurance companies, which doctors want. It has nothing to do with the patient's bank accounts. I assume this got mixed up, but by the $19 billion we put in the economic recovery package to help streamline the way records are kept with email. Rationing. There's misinformation out there that the draft bill will introduce a system of rationing health care, when in fact the health insurance industry already rations health care. Insurance companies every day ration health care. They ration what procedures can be conducted, what surgery you can have. The draft reform bills will ensure that people get the health care they need despite pre-existing conditions. It also ensures the draft legislation that doctors will have the best information available on what will work best for you. A couple more myths. The cost of the bill would add $1 trillion to the deficit. This legislation is by a resolution that we passed. It has to be budget neutral, has to be fully paid for. In fact, the legislation will make health care more efficient, reduce waste, fraud, abuse, and prevent expensive diseases before they occur. The cost we should be looking at is the cost of doing nothing. If health reform fails in 2030, family incomes will be $10,000 lower than if health reform succeeds. Two more things. Health reform does not cut Medicare benefits for seniors. The health reform bills actually improve the Medicare program by extending solvency, bringing down Parts B premiums, and ensuring adequate provider reimbursement so they can get Medicare patients. Finally, small business. I hope there's some small business owners. If not, there are a lot of people who work for small business. The legislation being contemplated will exempt small businesses from any requirement to cover their employees. For those who choose to be covered, there will be a tax credit to help, and small groups will have access to a new marketplace to help compare choices and lower administrative costs. And the insurance reforms will particularly help small businesses with lower premiums by eliminating discrimination based on health status, gender, pre-existing condition, and health claims. We've all had the experiences of company fights to get insurance for their employees. Somebody gets in an accident or gets sick, they cancel or raise the premium so they can't have the insurance. So I'm happy to answer any questions now that anyone has. I have on the line with me someone who's worked in health care and for me for 4 or 5 years. Her name is Kate Leone. Some of you have met her, but if there are some real specific questions that I can't answer, I will turn it over to Kate, and she will chime in. Kate is a lawyer. She's a graduate of Columbia Law School. She's, I'm prejudiced, but I think the most respected healthcare advocate we have in Washington, D.C. So I'll be happy to take questions.
Senator Reid, our first question comes from Sam Amici in Las Vegas. Sam, you're live on the phone. Sam? Sam, are you there? Okay, Senator, we're going to take our next question then from Evan Downey in Las Vegas.
Okay.
Let's go ahead with Evan.
Evan?
Good afternoon, Senator Reid. Thank you for the opportunity to talk to you. I'm actually not in Las Vegas at the moment. I'm in Nebraska with the military.
Well, it starts with an N, so that's fine.
You had the opportunity to work with my father many, many years ago when he was on the Planning Commission in Las Vegas.
What's the last name?
Downey.
Oh, sure. Jay Downey.
Yes, sir.
Yeah.
My question is in regards to healthcare reform in interests with our veterans and the military healthcare processes that we have that we need to continue to update and improve for our wounded warriors. What initiatives are supported in the healthcare reform that you're proposing?
What we're doing will not affect veterans' health care. We have just been through the trauma of coming back from Iraq and now Afghanistan. But the Wounded Warrior legislation, for those on the line who don't know what this is, we had a very difficult problem. People came back from Iraq, and there was no decent handoff. They were dumping, the military was dumping these people off into VA, and they weren't ready for it. And the Wounded Warrior legislation provided resources to allow the wounded warriors to come back and with dignity finally be transferred to the VA. And I will just put in a plug for the VA. 20 years ago, the VA was considered a very bad healthcare delivery system. Now, it's may not be an A, but it's certainly a B+. People are real happy. We know we have claims we're behind, but the healthcare generally is pretty good. Thanks a lot, Evan.
Senator, next question comes from Jan Woodman, who has a concern about the growth of government.
Where's Jan from? She'll tell us.
Jan's from State Line.
Yes.
Okay.
My concern is the growing size of our government. And I understand that either the House bill, one of the House bills, or the Senate bill is proposing up to 45 new agencies in this reform package. And I'm wondering what these agencies are going to do, how are they going to be funded, and how are they going to, what's the oversight for all of these agencies?
Well, first of all, Jan, I don't know about the number of these agencies. I don't know. There are probably agencies already in effect, but I don't know, frankly, what agency you're talking about. But let's talk about what this bill is going to do. We have to reform our healthcare system. I've talked about that in some detail, and I really believe that a lot. And I think that the purpose of doing this is to make a more streamlined system, to get rid of a lot of the bureaucracy we have. And in saying that, make sure everyone understands there is not a member of Congress that I know of that is considering or contemplating or wanting a single-payer system. Some people said, oh, all we're going to have is a European-type system. No one contemplates that. No one wants that. This will still be private insurance, plus, of course, we'll have Medicare and Medicaid and the VA. Next question.
Senator Reid, our next question comes from Michael Troiano in Las Vegas.
Okay.
Hi, Senator Reid. How are you doing today?
Good.
My question is about the legal immigration issue that we have in Nevada, and I understand, the Democratic Party's ideals on that side of it, but specifically with this health care reform bill, it's going to affect us in Nevada and Las Vegas specifically. The Review Journal came out with some kind of article last week that detailed that UMC, which is obviously failing right now, is spending over $24 million a year for dialysis for illegal immigrants. Now, I understand there's a compassionate thing that needs to be considered, but the Nevadans and the Las Vegans that are here illegally following the laws are the ones that are suffering from this. And in the current legislation, there is nothing that blocks these illegal immigrants from retaining these services. Do you support a amendment to the legislation that says that you need to verify your legality in the United States, or are you for the way the current registration reads?
Michael, here's what the law is in the United States. The law in the United States for 3 decades or more has been that if a patient comes to a hospital, doesn't have to be a indigent hospital like the University Medical Center, they have to they come to the ER in any place in the country without regard to ability to pay. These are people who only come in emergency situations. Health reform will not cover people who are not here legally, period. Now, as I said, the law would have to be changed, and I don't think that would happen, for someone who comes to an emergency room, no matter what their status may be, who are in a condition of stress, hospitals have to take those, but only emergency patients. And as far as the situation at University Medical Center, I used to be chairman of the board at that. That was the first elective job I had in Nevada. There has to be provision made that local institutions are reimbursed, because the problem with illegal immigration is not the problem of state or local government. It's a problem with the federal government, and the federal government must hold these facilities like University Medical Center whole for the work that they're doing. Next question.
I'll remind people now that if you'd like to ask a question, please press 0. Senator Reid, our next question comes from Joe Trujillo in Las Vegas. Joe has a question about the public option.
Okay.
Good afternoon, Senator. Good afternoon, Senator Reid. I was just, it's amazing the timing, but I was just reading the Las Vegas Sun, and it indicated that in a private meeting you had discussed with healthcare professionals your support for the public option. My concern is in the shouting matches and everything else that we've seen carried out this August, that the majority leader of the U.S. Senate probably hasn't been as vocal as I would like, and I would like to know whether or not you really are going to come out in favor of the public option in the health care reform.
Joe, I rarely have any private meetings anymore. The meeting that I've referred many times on this trip home, I've been home for 3 or 4 weeks, I've told people, whoever will listen, I'm in favor of the public option. And let me explain to all the listeners what this public option is all about. Let's step back just a little bit and understand why I'm concerned about a public option. In America today, there is only one business that is not subject to the antitrust laws, and that is insurance. Insurance companies have the right to gather together, conspire to fix prices, and all the things that would be violative of the Sherman Antitrust Act, and they're not subject to civil or criminal penalties. The only other business, I said one, there is another business, Major League Baseball. Other than that, insurance is the only business in America today that is not subject to antitrust laws. So that's what the public option is all about. We're going to have a private insurance system when we finish all this. But what we need is to make sure that we have a way of keeping the insurance companies honest. And what would that be? It would be a public option. Remember that word, option, public option. And we're working now to try to come up with a program that would allow that to take place. There's a lot of people who misunderstand this. They think it's some government program, but there are many ways we can do it. One would be to have an entity like Medicare. I really don't favor that. I think what we should have is a private entity that is has direction from the federal government, so that people who don't fall within the parameters of being able to get insurance from their employer, they would have a place to go. If we don't do this, then we're at really the mercy of the insurance industry, because I don't know how many other on this phone call are federal employees, but every year we're given choices. They send us, I don't know how many, but lots of different choices. Every year is a time that people can decide what insurance they want. But they're all insurance company options. And what we're talking about is to having, in addition to these options in this so-called exchange, we would have a public option that in effect would be in competition with the insurance companies. Thank you very much, Joe, but I am in favor of the public option.
Thank you. I'd like to remind callers that they can press 0 to ask a question. The next question comes from Jesse Anderson from Las Vegas, who has a question about Medicare. Jesse, are you there?
Yes.
I'm ready for your question.
Oh, okay, Senator. Like I'm a 65-year-old disabled person, and I like to know, would these options and things interfere with my getting the help that I need to stay healthy?
Let me repeat what I said earlier, Jesse. The health reform bills actually improved Medicare by extending solvency, bringing down Part B premiums, and ensuring adequate provider reimbursement so that they can continue to see Medicare payments. Let me give everyone here on the line a little story. Landra is my wife, we came back from Washington. And as some of you know, I live in Searchlight. That's 60 miles from Vegas. We land at the airport in Las Vegas. We always stop, with rare exception, stop at a grocery store and get a few groceries to get us by for however long we're going to be there. The first day I was home, we stopped at a store. And I'm standing there, and a man comes up to me and said, "You're Harry Reid, aren't you?" I said, "Yes." He said, "I'm from the state of Washington." And he said, "I've had cancer of the stomach. I had a big tumor in the back of my leg. My wife has had breast cancer. I want you to go back to Washington and tell your colleagues, keep government out of our health care." And he kept going on. I said, "Tell me, sir, who paid for your surgeries?" He said, "Medicare." I said, "Were you happy with it?" I said, "Yes." I said, "Well, stop complaining about government health care, because that is government health care." So Medicare works pretty good. We don't plan to have any socialized medicine. We don't plan to take the private sector out of what we're doing. But Medicare is there. We're going to make it better, not worse. Thanks, Jesse.
Senator, our next call comes from Judy Mead.
Judy?
Judy.
Where's Judy?
Judy, are you there?
Where did Judy
No,
go?
I am.
You're still, who's this?
Oh, let's see. Judy?
Hello.
Oh, there's
Thank
Judy.
you, Judy.
Yes.
Judy, where are you calling us from, Judy?
Las Vegas.
Oh, good.
I wanted to make a comment, more or less, I guess, that the fact that these people are in an uproar and so rebelling about this bill because they don't know what's in it, and they're furious. What is it that people or the legislative can do to get the word out there and let people know what is in this bill without reading thousands of pages, and how it's really going to help people so they're not so angry? And also, people have been on national television with AARP stating that they're going to let their membership last because this is not senior friendly.
Well, let me say this. AARP supports what we're doing. They're in favor of this legislation. Last I heard they were, and I don't think that's changed. They've been very, very assertive, recognizing that what's going on needs to be fixed. And the problem we have is there are a lot of people who are just yelling and screaming. They don't want anything to happen. We need to do this. Today in America, 1/6 of every dollar we spend goes for health care. 1/6. If we don't change this so-called bend the curve, in 11 years, 2020, the cost will be 35 cents of every dollar spent in America will be for health care. And we can't do that. It just simply will not work. The insurance industry is trying to stop us from reforming what we're doing, and that is wrong. That what is going on in the health industry is really unbelievable. For example, one CEO made $22 million in overall compensation, plus another $250 million in unexercised stock options. I mean, isn't enough? We have to change this program. And so in answer to your question, people need to listen. We need some help from the press also, to be candid with everybody. They can't ask enough questions about town hall meetings. You've got to have more town hall meetings. Town hall meetings have changed in America. I've been doing town hall meetings just like we're doing right now for at least 2 years. It's a great way to reach lots and lots of people and get information. The press has not been, I don't believe, expressive enough in giving the work that we're trying to do proper footing. They would rather see on television a fight that takes 30 seconds, people yelling at each other, than someone sitting down and explain how we're trying to bend the cost curve, how we're trying to change things. We have to change what's going on in the country today. The World Health Organization ranks us on a par with Serbia. We're just barely in the top 40. Our childhood deaths, infant mortality is extremely high. It's Exorbitant medical costs have become a leading cause of personal bankruptcy. We're the only developed country without a national system that is meaningful to the people of the country where they live. The healthcare industry generates enormous profits. The profit margin of three of our largest insurance companies in 2006 ranged from 26 to 29%. So we've got to also change it and give incentives for family practitioners. We need more of them. We need to give them maybe loan forgiveness, get them practicing medicine and doing it well. 50%, a recent poll, 50% of the general practitioners in America today, if they had someplace else to go, would get out of practicing medicine. Now that's scary, isn't it? So next question.
Thank you, Senator. If anybody would like to ask a question, please press 0. Our next question comes from Shirley Germain in Las Vegas. Shirley,
Hello.
are you there?
Yes, hi, Senator. Hello?
Hi. Hi, Shirley.
Hi. Yeah, hi. I do have a question. I just want to make a comment. I do agree with you on the media. I think that their coverage has been appalling. And I think they incite a lot of the negative attitudes about the health reform bill. And then I had one more comment and then my question. I don't understand why we have to be bipartisan. I think we need to be nonpartisan, need to do what's right and not worry about whether we're appeasing the Republicans or anybody else. Just do what the right thing is. So, having said that,
okay,
yes.
Please.
Yeah, well, my question really was, I had heard, and I don't know if this is true, that the Democrats have agreed not to negotiate with pharmaceuticals for lower rates for Medicare Part D, and if the costs were the same as, for example, the veterans, I think the savings could be in the hundreds of billions and a large saving for seniors. Is that fact true?
Well, Shirley,
I heard nothing about that.
Let me say this. I am the head Democrat in the Senate. I haven't agreed. I guarantee you that. Let me tell you some of the things I think are so unfair. First of all, your comment about bipartisanship. People wonder why I have been so persistent in trying to get a bipartisan bill. I've done that because under the rules of the Senate, we're better off if we can do a bill where we get a little bit of Republican support. The leaders in this, Republican leaders in the Senate, McConnell and Kyle, have said they don't want to do health care reform. The Republican leaders in the House, Boehner and Cantor, have said they don't want to do health care reform. Excuse me, I just took a sip of water. So we've been trying very hard to get some Republican support for our legislation. I have 60 votes on paper, but it's only on paper. Senator Kennedy, as you know, is dead, but he hasn't been working very much for the past year. He hasn't been voting hardly at all. Senator Byrd hasn't been voting a lot. So we're at 58 senators most of the time, so we need Republican help. And that's why a bipartisan bill is important. If you could see me, I would widen my arms as far as they would go, and I would say, this is how much we can do with a bipartisan bill. Now, if we can't do a bipartisan bill, then we will do a partisan bill. I don't want to do that. Under the rules of the Senate, we passed a budget resolution that says we can do but with a simple majority, we can do education and we can do health care. I hope we don't have to do that, because if you could see me now talking about what I can get done with reconciliation, it would only be about 3/4 of what I could do with a bipartisan bill. So that's why I'm stuck on bipartisanship and would really like to get that done if I could. When I became the majority last Congress, I introduced S3 to allow Medicare to negotiate with the pharmaceutical industry. I brought it to the floor, but we didn't have enough Democrats and it failed. And let me explain in more detail what I'm talking about. It is the law, and it was because of President Bush's Medicare bill, that says the pharmaceutical companies, Medicare cannot negotiate with drug companies to get lower priced drugs. Insurance companies can do it. All the health delivery organizations can do it. The Veterans Administration can do it, but not Medicare. And we need to change that, and that's what Shirley was talking about. And I've not agreed with anybody not to do that.
Thank you, Senator.
Next question.
Next question is going to come from Carol Vance in Dayton, Nevada. Carol?
Yes, I'm here.
Go ahead.
Hello?
Carol,
Hello?
I'm right here.
Hi. How are you today?
I'm fine. My little niece teaches school in Dayton.
Oh, really?
Yeah.
Maybe I've seen her.
Yeah, I probably have.
My question is similar to what you've already talked about with Medicare. How does this bill change Medicare, and how does it change the supplemental insurances that all of us or some of us have that supplements Medicare?
All supplemental plans under any piece of legislation that has been contemplated or the House has actually written, all supplemental plans are protected. We don't want to hurt Medicare. We only want to make it stronger. And it's just a scare tactic of people saying we're going to wipe out Medicare.
Senator, our next question comes from Honora DeRocher in Reno.
Lenore, are you there?
Yes, I am, Senator.
I'm right here in Reno myself. I'm going to take an airplane, as I told everybody before I started this, when we complete this, to head off to Boston. So very happy to hear from you.
Hey, well, I have 4 adult children, all with no insurance coverage.
I've got 5.
And you have 5 with no insurance coverage?
Yeah, no, I shouldn't have said that. Go ahead. I have 4. I hope they have insurance coverage.
Oh, well, only one of them is working. The others have lost their jobs and can't find jobs. One is working, but even he can't afford to take the insurance that is offered by his employers. It's just too expensive with the cost of living and everything. Will they be able to get help with dental and eyes and other stuff through this new bill?
Yes. Let me say this. First of all, the story of your boys is a story of millions and millions of people in America and thousands of people in Nevada. I was in Nye County. I was in Pahrump on Monday at the Sheriff's Department. And I walked into the Detective Bureau. The sheriff was showing me around, and he said, Tom isn't here. I think that was his name. He said within the past month, he and his wife had a baby. The baby has a congenital heart defect. And I thought to myself, as long as he's working here, that little baby's going to be fine. But if he loses his job for some reason, he get laid off, they cut back, or he changes jobs. That little girl, the rest of her life, unless we change things, will never be able to get insurance because of her pre-existing condition. And that's what we're trying to protect here, is that insurance companies can't deny people coverage because they have diabetes, they have a congenital heart defect. They should be part of the pool to allow everyone to have health insurance. And would you go ahead and talk about? I'm going to have Kate chime in here and talk about what we expect the people, how people like your 4 boys would be covered when we finish all this.
Sure. What we plan to put in legislation will be a new area where people who don't have employer-sponsored coverage or who have an offer of employer-sponsored coverage that is not affordable to them will be able to go shop for insurance, find competitive options, and if they fall within certain income levels, will get subsidies to help them afford it, so that no one should have to say, I can't afford to have coverage under the new system. In addition, for your sons who lost their coverage because they lost their jobs as part of this recession, I don't know if you're aware of the provisions that Senator Reid helped include in the economic recovery package to have a subsidy for COBRA coverage, because as we all know, COBRA is extremely expensive for folks. But if they had employer-sponsored coverage, lost their jobs, and are now suffering without insurance in the meantime, perhaps they might be eligible for that COBRA subsidy. So I would urge you to contact our state offices to see if they can provide some assistance on that.
And you're in Dayton, so that's 686-5750.
Thank
Next
you, Senator.
question.
Next question comes from Shirley Heward in Gardnerville.
Shirley, are you there?
Yes. Yes, Senator Reid, I'm very curious why, when there's been so much negative publicity and most of the people don't want this plan, why you and Pelosi are pushing it.
I'm happy to answer. Shirley, I'm happy to answer that question. There have been many recent polls taken of the American people, and it shows almost 70% of the American people believe that we need to do something to reform our health care system. Now, there's been a lot of confusion, and people in the same poll ask, how do you like what's going on in Washington? And there, it's around 50%. It's a smaller number. But most people in America today want health insurance reform. It's not Pelosi. It's not Reid. It's American people. And President Obama, during his campaign, one of the things he campaigned on is doing something about health care. And the President and I have had a number of conversations about health care. First of all, when we got started on this, I said, Brock, this is really hard. And he said, Harry, if it were easy, someone else would already have done it. Number two, during a telephone conference call I had with him and a few other people, the President of the United States said to us, make sure that when we finish this, it's not only a plan that helps poor people, but it's also a plan that helps middle-class America. So that's our goal. The American people want health care reform. They're upset and concerned about what's going on in Washington with all the negativity, and I can understand that. But we're going to do health care reform. It's something we have to do not only to help people stay well, but also to help our economy. Would be a boost for our economy to do something to curb this curve that we have that is going upward all the time.
Thank you, Senator. I'll remind everyone that if they'd like to ask a question, please press 0. The next question is going to come from Greg Corkin in Sun Valley. Greg, are you with us?
Senator?
Yes, Greg.
I have a question. I belong to Local 350, Plumbers and Pipe Fitters, and my wife works for the telecommunication workers. And both of us have received writings and letters from our union representatives there in Washington that part of the health care reform is also wanting to tax our health care benefits. And I want to know, because I'm not going to read the bill, if this is true, and then express my non-support of that situation.
Greg, first of all, there are 5 committees that have jurisdiction of health care, 3 in the House. All 3 of those committees have completed their work. And you could read every page of those big bills, and there is not a single word in those bills that taxes benefits of you, your people who are getting benefits. In the Senate, there are 2 committees that have jurisdiction. The HELP Committee stands for Health, Education, Labor, and Pensions. That bill has been reported out. That bill took to get it out of committee took a long time. They had more than 600 amendments offered. There were 211 Republican amendments that were accepted as part of the package, and that's on the floor. That bill does not say a word about taxing benefits. The Senate bill, the finance bill, that is the remaining committee that has not reported out a bill, and that's what we've been talking about, trying to get something bipartisan out of that so we can work on the Senate floor. At this stage, there has been totally no agreement of the members of the Finance Committee of taxing benefits. Thanks, Greg.
Senator, our next question is going to come from Linda Smith in Reno, who has a question about malpractice reform.
Hi. I have a question about medical malpractice reform, and basically, Senator, I'm wondering, do you think that medical malpractice reform with a cap on non-economic damages should be part of the new health care plan?
Okay, let me talk about this. Most of you don't know, but a few do. Over the years, I've been a marathoner. I've run about 15 marathons, 26 miles, 26 and a quarter miles. And in the process of training for those races, I've run thousands and thousands of miles. Every morning, I still get up, with rare exception, and do 4 or 5 miles. Now, the reason I mention that to you, I was standing on the Senate floor. For 6 years, I was the assistant leader, and I was on the floor all the time. And I felt something in my foot. It was like I felt my sock had gobbed up on the bottom of my shoe, gathered up. So I walked off the floor and privately took my shoe off and straightened out my sock, but there was nothing wrong with my sock. So, make a long story short, I went to podiatrists, and it was very painful. It got worse and worse. And I went to orthopedic guys. They put inserts, they tried cortisone, and they finally had to do surgery. So I'm at the hospital. I lay down on my back with my little gown, and I look down at my foot, and there's a big magic marker with an X on my foot. And I said to the people, and why did you do that? And they said, well, we do that because we want to make sure we get the right foot. I said, you got the wrong foot. It's my left foot. Now, I also have, during my entire life, I haven't never talked a lot or very loud, but I've always been very curious. And in classes, even though I thought maybe some kids may be smarter than me, they couldn't ask better questions. I would always ask questions. Some people didn't do that. My wife, for example, is a shy person. She was born shy. She'll remain shy. I wouldn't be surprised if she were laying on that bed waiting for her foot to get operated on. If she saw that big magic marker, she probably wouldn't have said anything. Now, the point is this. Whoever that doctor is, and I'm not going to recite his name, that was negligent what he and his people did. They should not get off scot-free for cutting off the wrong foot or operating on the wrong foot. Having said that, I think that there's too much defensive medicine, and I think there are things we can do about medical malpractice. I don't think doctors should be treated for their wrongs much differently than anyone else. If someone who's on part of this conference call drives off, runs through a red light, and causes someone to be a paraplegic, they should have to pay proper damages for that. But here's an idea that I have, and I'm taking to Washington with me on malpractice. Linda, we had for 4 or 5 years in the state of Nevada, about 18 years ago, I don't know, time goes quickly, for 4 or 5 years, we had a program called a medical legal screening panel. We had a group of doctors and lawyers who were appointed to screen medical malpractice complaints that people had. I was in Las Vegas a few days ago, and there was a doctor there who had been on one of these panels. And he said that half the cases brought before these doctors and lawyers, they just threw them out. They were worthless. Now, under that scenario, even if the medical legal screening panel said your case had no merit, you could still bring it forward, but you would be subject to monetary punishment. I don't think it's the right word, but you'd have to pay if you lost the case after you took it. Now, that was a great program. It didn't continue because the lawyers and doctors fought over some of the provisions. It was a right thing to do. And I think we need something like that to ferret out the bad cases. Right now in Nevada, the bad cases just go to court. Good cases just go to court. It just clogs up the courts. We've got to stop that. And I think this would help the doctors in not being able to be so defensive in the medicine they practice, and I think it would be fair. Thank you, Linda, very much.
Senator, our next question is coming from Joseph Wozniak in Reno.
Good afternoon, Senator.
Yeah, Joyce?
Joe.
Joe, well, you don't sound like a Joyce.
Reno, Nevada, the land of no state income tax.
Yeah, that's true.
My question is as follows, sir. If we take the Congress and the Senate, and I'm assuming the dependents are covered, and I'm going to further assume that you've got staff that are probably covered under the government plans, that's like a small company of 1,000 employees or more. And again, I'm making a couple of assumptions. My question is, if you're going to put in this plan for us, why is this plan not going in for you folks at the same time? Because your plan is an excessive cost. I know some numbers. And our plan is clearly designed to save some money. So please tell the audience why we should go on a more affordable plan.
Joe, you're going to be real happy. In the Senate bill, I told you about the Help Committee, the only committee that's reported in the Senate. That's in the Senate bill. We're part of the program, okay? All federal employees are part of the program. Just members of Congress are part of the program. We're going to be part of the mix if the Help Committee bill prevails. And we don't have a special program. Everyone should understand that also. We're part of the federal insurance. We have millions of federal employees, and we're part of that plan. Thanks, Joe.
Senator, next question is from Marie Kissinger on Sparks.
Okay.
Marie?
Hi, Senator Reid.
Hi.
I have a question. I want to ask if you're going to support a bill that includes payment for abortions. And I'd also like to ask you why you begrudge businesses making money, or as you say, when it came to the insurance companies earning profit.
The first question is really easy. None of the bills, none of the three House bills, none of the one Senate bill, none of them use any taxpayer dollars for abortions. The Senate bill includes a conscience clause, which allows institutions, including those like Catholic hospitals, to make decisions about whether or not to provide abortions without having to worry that their decision will shut them out of the insurance provider networks. The House bill states, and I quote, "Health insurance providers aren't required to or prohibited from offering abortion coverage. The cost of such coverage would be exclusively paid by premiums, not by public subsidies. Public funding abortion would be permitted only as under current law under the so-called Hyde Amendment, which is in the case of rape, incest, or when the woman's life is in danger." That's been the law in the country for several decades. And I would say about companies making money. People have a right to make as much money. We have a free enterprise system, and that's good. But as I said earlier, some of you didn't hear me. I think it's wrong that the insurance industry is not subject, like every other business in America, to the antitrust laws. And that's the reason that I think we have to take a look at what's going on with insurance. We have a few huge companies who are controlling much of what takes place in health insurance. And I think we have an obligation and a right to look at their compensation, just as we did with the financial meltdown on Wall Street. We took a look at these bonuses. We stopped some of them, maybe not enough of them. But I think when things get out of hand, your government's the only place you can go for a little bit of solace and relief.
Senator Reid, our next question is from Georgette French in Reno, who has a question about pre-existing conditions.
Okay.
Hello, Senator Reid.
Georgette?
Hi.
I would like to know if this new bill, I'm retired, I'm 64 years old, and I had insurance. And the insurance kept going up so high that it was over half of what my Social Security is, so I had to drop it. I'm not covered with any insurance now because everything I contact, they don't cover pre-existing, because I have asthma and I take a heart medicine. Will the new bill make them cover so at least you can have insurance for pre-existing?
Yes. As I said earlier, I was on Monday in Pahrump Sheriff's Department. One of the detectives' daughter within the past month had heart surgery. They had to move the child to Las Vegas. The child is very sick, congenital heart defect. That little girl, as long as her dad works there, will be okay. But if he gets laid off, they have a cutback, or he has to change jobs, she's in big problems unless we change the law because she has a heart defect. She has a pre-existing health condition, and most insurance companies simply won't give her coverage. So we must have the law that people cannot be denied coverage for pre-existing conditions. And we shouldn't allow health insurance companies to drop people who become ill or are hurt, and it happens all the time. That isn't good. It shouldn't happen. We should stop that. Our legislation will prohibit insurance companies from denying care based on pre-existing conditions.
Thank you, Senator. Our next question comes from Mildred Reid in Las Vegas.
Mildred? Okay.
Yes, Senator. Okay. First, I have a question, and then after that, I would like to make a comment. Okay.
Okay.
First off, my husband's been ill for a couple of years, in and out of the hospital, and every time we go there, we have a wait of at least 4 hours, maybe more, to be admitted only. And then There's always a lot of time before a doctor even looks at him. Now, with all these more people being covered, it's going to get worse because every time you go to admitting off a hospital, there are thousands of people sitting there waiting. So how is this going to improve anything? It's going to make it worse.
Okay, let me answer this question, then you can make your statement, okay? First of all, are you privately insured, or what do you have when you go to the hospital? Oh, that's too bad. I'm sorry about that, because she had a comment she wanted to make. But anyway, I'm sorry about that, Mildred, but let me answer your question. This insurance reform that we're going to do, there will be millions of other people, if we are successful, who will be covered. Right now, if someone is not covered, they go to an emergency room. They go there for sore throats. They go for automobile accidents. The most expensive care in America today is in an emergency room. And so what we have to do is understand that those people who go to the emergency room, we're paying for them anyway, because it increases our insurance premiums, our hospital bills, and our doctor bills, and of course it increases our indigent taxes. So we need to increase the number of physicians training in Nevada. I'm working with Senator Nelson from Florida to make sure that we have, with the tremendous population explosion we've had in Nevada, we're having less people being able to be trained in Nevada, and we've got to change that. We need to focus on primary and family practice. The physicians who train in our state are having to leave after medical school to do their residencies. The residencies, they've cut them back here in Nevada. My legislation, and that of Senator Nelson, would keep them here and encourage them to go into primary family practice. I think we should look at forgiveness of loans for people who are willing to go into family practice. So I am sorry you have to wait like that, but I think things will not get worse. They will get better. They'll get better because people will have the opportunity to do preventive medicine. You know, there are books written. There's a new book out by a famous author. His name is Andrew Weil, W-E-I-L. He's a doctor. He's a Harvard medical graduate. And he believes there are all kinds of things that we can do that are preventive in nature that will not cost us money but save us lots of money. Next question.
Senator Reid, our next question is from Kathy Endo in Sparks.
Okay.
Kathy?
Hi, Senator Reid. My name is Kathy Endo, and I am a family physician. I just wanted to make a comment, and your last comment was perfect feed-in. I also work rural ERs, so I do see the problem with the uninsured, and there is a desperate need to make some reform, so I want to comment on that. I also work with the population that is also in need, which is the university. I work at the Student Health Center, and I see these students who are forced off their family or their parents' insurance, and they have no means to get medical care, and we are forced to make decisions about medicines versus going to school versus eating. And so I just wanted to continue to encourage you to push for reform and to support family physicians, which it sounds like you certainly do, and you see the importance of primary care. So I wanted to thank you for that.
Doctor, thank you very much. We have time for a couple more questions, and I'm headed to Boston.
Senator Reid, I'd like to make a note to everybody on the phone right now that those who don't get their questions asked live on the phone will get a response from your office. We have all of their contact information.
Well, I appreciate that. Thanks. We need to do that. We got a good crew. Kate will be running shop on that and make sure the answers are right.
Our last question is going to come from Paulette Francis in Las Vegas, who has a question about the public option.
Paulette?
Hi, Senator. You know me, obviously, in my other role, but I got called because I'm a registered Democrat, and most of my questions...
Although Paulette, I would say on this phone call, they're not just Democrats. We get independents.
No, of course not. Well, yeah, a lot of people could sign up, but I was called. So.
Oh, Paula. I thought it said
it's
Paulette.
Paula, yeah.
I thought I recognized that voice.
Yes, and we'll go into this in great detail on Monday. But I want to know, because people ask me and I don't know how to explain it, how is the public option paid for?
Public option, there's really nothing to pay for. That's the whole key. There's nothing to pay for. It is an entity that is set up, as I've indicated, to keep the insurance companies honest. There would be some small administrative costs, but remember, Medicare is one of the most efficient administrative entities we have. The overhead of Medicare is a couple percent, 2%, and with the public option, they would pay premiums just like anybody that fell into that category would pay premiums just like everybody else. It's not a program set up for people who are losers. Some people may have had problems because of for other reasons that would fall into this category. And if we don't do the public option, everyone will just fall within the exchange and will be at the total mercy of the insurance industry. And that's why we need a public option. Let me, first of all, Paul, I'm sorry I didn't recognize your voice, but I did. I want to tell everybody how much I appreciate the civil nature of this discussion this afternoon. This was wonderful, and for me, it's extremely helpful. I can only do what my constituents want me to do, and it's very clear that the majority of the people today recognize that this is no easy push, but we have to do something to change the situation that we have now. Think of the sad stories we've heard today. A woman with 4 grown children, none of them have health insurance. And think of the many stories just like that. 220 stories today will come from Nevada just like that, people who have lost their insurance. Now, what we're going to do is do our very best to come up with a bill. I repeat, the health insurance problem in America today is not a problem that relates to people who are Democrats that get sick, or Republicans that get sick, or independents that get sick. Everybody gets sick and hurt. We have to have a program that's fair and reasonable. We should hold our heads not as high as I'm not holding my head as high as I would like because of the significant problems that we have with health care in America today. We have, as I've indicated, are 1 out of every 146 children, according to this book of Dr. Weve, die. 29,000 children die in 29,000 children die in America before they're 1 year old. So we need to do better than what we have done, and we can do it. There's money. It's not as if there isn't enough money. We're spending lots of money. The problem is where the delivery system is flawed and it's not working right. So everybody, thank you very, very much. I wish you all well, and we'll be back in Searchlight tomorrow at 5 o'clock or so. But in the meantime, I'm headed to Boston. Thank you all very much.